Welcome to another informative and important video on our channel. Today, we will address an essential health topic, the 10 signs of kidney stones that you need to know about. Kidney stones are a painful and potentially serious condition, affecting millions of people around the world. After all, who has never heard of someone who faced the agony of a kidney stone? So, before we continue, don't forget to subscribe to our channel to receive relevant content about health and well-being. It is essential that you follow every detail of this video, as understanding these signs can make a difference in the early detection and effective treatment of kidney stones. The importance of this cannot be underestimated, as early identification of symptoms can prevent serious complications and alleviate unnecessary suffering. So, stay with us and learn how to recognize these vital signs for your health. 1. Severe back pain. The first sign of a kidney stone, severe back pain, is often described as a distressing, searing experience that radiates from the lower back, below the ribs, toward the lower abdomen. This pain is caused by the stone passing through the urinary ducts, which are narrow, and irritating the surrounding nerve endings. The intensity of the pain can vary from person to person and depends on the size and location of the stone. Some people report experiencing intermittent waves of excruciating pain, while others experience constant, debilitating pain. The presence of this severe back pain is often a clear sign that a kidney stone may be moving, and it is crucial to seek medical assistance for proper evaluation and treatment, as the pain can be unbearable and can be associated with complications. Potentials. 2. Pain in the abdominal region. The second sign of kidney stones is pain in the abdominal region, which usually appears on the side of the body where the affected kidney is located. This abdominal pain is characterized by a sharp, dull sensation, often accompanied by discomfort. It's important to note that abdominal pain due to kidney stones can easily be confused with other conditions, such as gastrointestinal problems or even appendicitis, due to their location. However, a hallmark is that the pain usually radiates from the back to the abdomen and tends to increase in intensity as the stone moves along the urinary tract. Therefore, if you are experiencing severe abdominal pain and suspect a kidney stone based on these symptoms, it is advisable to seek medical attention for an accurate diagnosis and guidance on appropriate treatment. 3. Pain that radiates. The third sign of kidney stones is pain that radiates to other areas of the body, often extending from the lower back and abdominal region to the groin and, in some cases, even the genital area. This radiation of pain is a distinctive feature of kidney stones due to the obstruction and passage of the stone through the urinary ducts. Pain that moves along the urinary tract is often described as sharp, crampy, and can cause significant discomfort. This traveling pain sensation can be worrying and unpleasant for those who experience it, and it is important to recognize it as a potential symptom of kidney stones and seek medical advice for proper evaluation and treatment in order to avoid further complications. 4. Urgency to urinate. The fourth sign of kidney stones is the urgency to urinate, which is often caused by irritation of the stone in the urinary ducts. This urgency can come on suddenly and lead to a constant urge to urinate. However, it is important to note that although urgency is common, the amount of urine released may be limited due to possible partial obstruction caused by the stone. This can be frustrating and uncomfortable for anyone going through it. Urgency to urinate is a notable symptom that should be taken seriously, as it may indicate the presence of a kidney stone and the need to seek medical assistance for proper evaluation and treatment. Ignoring this sign can result in further complications, making immediate medical follow-up even more essential. Therefore, if you are experiencing this urgency to urinate, do not hesitate to seek medical advice to ensure your health and well-being. 5. Blood in urine. The fifth sign of kidney stones is the presence of blood in the urine, a symptom known as hematuria. When a kidney stone moves along the urinary tract, it can cause irritation and damage to internal tissues, resulting in the release of blood into the urine. This can give the urine a reddish, pink, or brown color, depending on the amount of blood present. The presence of blood in the urine is a clear sign that something is wrong and should be evaluated by a healthcare professional. It is important not to ignore this symptom, as it may indicate not only the presence of kidney stones but also other underlying medical conditions that need immediate treatment. Therefore, if you notice any change in the color of your urine, it is essential to seek medical assistance to determine the cause and receive guidance on the next steps in treatment. 6. Nausea and vomiting. The sixth sign of kidney stones is the occurrence of nausea and vomiting. The intense, sharp pain associated with kidney stones can trigger a nausea response in the body, often followed by vomiting. These symptoms are natural reactions to the intense pain and discomfort caused by the moving stone. Nausea and vomiting can be particularly debilitating and distressing, making the situation even more uncomfortable for the patient. It is important to recognize these symptoms as possible indicators of kidney stones and seek medical assistance, as doctors can help manage symptoms, diagnose the condition, and determine the treatment needed to alleviate discomfort and prevent additional complications. 7. Difficulty finding a comfortable position. The seventh sign of kidney stones is difficulty finding a comfortable position due to intense pain. When a kidney stone is moving or causes partial obstruction of the urinary ducts, the pain associated with it can be so sharp and excruciating that patients have difficulty finding a position that relieves the discomfort. This often results in constant movement, squirming and restlessness as the pain does not subside easily. The incessant search for relief is a hallmark of this symptom and may indicate the urgent need for medical attention. It is crucial that those who experience this difficulty finding comfort recognize this sign as a possible indicator of a kidney stone and seek medical help for proper diagnosis and treatment, as the severe pain can be debilitating and requires medical intervention for relief. 8. Fever and chills. The eighth sign of kidney stones is the possible occurrence of fever and chills. Although not all cases of kidney stones are associated with infections, when a stone causes obstruction or prolonged irritation to the surrounding tissues, it can create an environment conducive to the growth of bacteria, resulting in a urinary tract infection. This can lead to the development of fever and chills, which are common symptoms of infection. Fever is the body's response to fighting infection, and chills often accompany an increase in body temperature. Therefore, if someone with a suspected kidney stone experiences these symptoms, it is vital to seek medical assistance immediately, as an untreated kidney infection can be serious and requires appropriate treatment, such as antibiotics, to prevent further complications. 9. Difficulty urinating. The ninth sign of kidney stones is difficulty urinating. Although the urge to urinate is common due to irritation caused by stones in the urinary ducts, some people may also experience difficulty starting or maintaining urinary flow. This occurs when the stone partially obstructs the urinary tract, making it difficult for urine to pass. The feeling of straining when urinating or the inability to release urine completely are indicative of this symptom. It is important to recognize that if you experience these difficulties, they may be related to a kidney stone and should not be ignored. Seeking medical attention is crucial to evaluate the cause of difficulty urinating and determine appropriate treatment, which may involve removing the stone to relieve the obstruction and restore normal functioning of the urinary system. 10. Recurrent kidney stones. The 10th sign of kidney stones is the occurrence of recurrent kidney stones. If someone has had kidney stones in the past, they are at greater risk of developing stones again. This is important because kidney stones can be a chronic problem for some people. Genetic predisposition, poor diet, chronic dehydration and other factors can contribute to the recurrent formation of kidney stones. Therefore, those who have a history of kidney stones should be especially aware of symptoms and follow medical recommendations to prevent recurrence. This may involve dietary changes, increasing fluid intake and, in some cases, prescribing medication to prevent new stones from forming. Awareness of the tendency to have recurrent kidney stones is critical to the proper prevention and management of this condition. In conclusion, the 10 kidney stone signs discussed in this video provide a comprehensive overview of symptoms that may indicate the presence of this painful condition. Recognizing these signs is crucial to seeking appropriate and timely medical help. However, it is essential to emphasize that each individual is unique, and symptoms can vary in intensity and presentation. Therefore, while this content provides valuable information, it is not a substitute for advice from a healthcare professional. The importance of applying the concepts discussed here lies in making people aware of the symptoms of kidney stones, encouraging them to seek medical assistance as soon as they identify any warning signs. Seeing a doctor will allow for an accurate diagnosis and personalized treatment plan, ensuring the best possible care and avoiding future complications. Therefore, when experiencing any of these symptoms, do not hesitate to seek medical help to ensure your health and well-being. Thanks for watching our video. Sharing this content can help make more people aware of the signs of kidney stones, allowing them to also recognize these symptoms and seek help when needed. Remember to share this video with your friends and family so everyone can benefit from this crucial knowledge. And be sure to watch the next video that will appear on the screen to continue learning and taking care of your health. To the next. Thanks for watching.